Thank you for joining us on this call. My name is Brian Marvel. I'm president of PORAC. Before we start this, I'd like to have a little disclaimer. This call is being recorded, and we'll make sure to send out a link after the event for your future reference. Joining me today is the Vice President of PORAC, Damon Kurtz, and the Region 2 representatives, Tim Davis, who is the Treasurer of PORAC and also with the Sacramento POA, Randy Banama, who is the Secretary of PORAC in the San Joaquin County DSA, and Tim Coffrin, who is with the Kern Law Enforcement Association. Your time is incredibly valuable, and even more so during this crisis, so I definitely want to thank you again for taking the time out to be on this call. As we mentioned in the email invitation that went out, we're going to begin with a brief update before we get into the question and answer phase of today's meeting. Before we take any questions, if you're using the Zoom app, you can click the raise hand icon on the bottom left of the Zoom window. You'll also be able to see the hand icon turn green. That way it'll help me identify people that have questions. Let me begin by saying we're faced with an unprecedented challenge, and our law enforcement community wants you to know we are your partners in addressing this challenge and containing the COVID-19. Law enforcement agencies throughout California have deployed teams of officers to go above and beyond their call of duty to aid their communities during this crisis. We're helping to deliver meals to seniors and at-risk youth. We've assigned officers to grocery stores and new emergency shelters to ensure people feel secure. Some of our law enforcement agencies have moved to longer shift, canceled training and vacation time to make sure that our staffing is appropriate to meet the needs of our communities. Peace officers support all first responder calls, and I think this is important. You have to recognize when somebody calls 911 and reports a fire and a medical emergency request or a welfare check. I would say by and far, peace officers respond to those calls, and usually we're the first ones on scene. While there's a heightened need for officers across California, we've had a number of law enforcement officers test positive for COVID-19 and many more who have called in sick due to the symptoms of COVID-19, but who have not been tested. Along with our doctors, nurses, and food providers, our officers play an essential role in responding to this crisis, and we too are feeling the strain on our resources. Our objective today is to provide you with a brief overview of the resources we need to ensure we can continue to proudly serve our communities during this difficult time. As you know, preventing the spread of COVID-19 is the primary objective of this nation, and it's ours as well. Essential personnel must continue to show up for work or at greater risk both of contracting and spreading the virus. To keep our officers and those we serve safe during this pandemic and to help contain it, we are in urgent need of additional personal protective equipment, which you've probably heard as PPE. Right now, we have officers in the field that either have no masks or only one. Officers are having to choose between wearing their mask or offering it to an individual they're interacting with. Our officers are running low on disinfectant that is needed to properly clean their vehicles and equipment between calls. I recently came in possession of a national law enforcement report. Law enforcement, which includes jail facilities and court security, will need approximately 11 million N95 masks, 11 million disposable gowns, 11 million eye protections, 23 million gloves, and almost 2,300 gallons of disinfectant. One of our second priority is testing. We're trying to secure expedited testing sites for first responders showing symptoms or who have encountered an infected individual. We recognize that we have limited tests available across the nation and within our state. However, our law enforcement officers come in contact with some of the most at-risk citizens on a daily basis, the homeless and elderly. We cannot keep these populations safe if our officers are unknowingly carrying or transmitting the COVID-19. I recently read reports where people can be asymptomatic with the COVID-19 virus, which puts more people in jeopardy if our own officers don't even know they have it. Seen in Seattle and Chicago about first responder only test sites. Sadly, in Chicago, when they opened it, they ran out of their test kits within 4 hours. Seattle's had the greatest success to date, and they were the first. California must establish designated COVID-19 testing sites for first responders throughout the state. Been told to me via the governor and our website that was created by the state, there are 22 health labs with testing capabilities. Recognizing that it will take time to establish these sites, high-risk regions with the greatest number of confirmed COVID-19 cases should be prioritized first. Third, and more of a midterm priority, is to establish COVID-19 as a presumptive occupational illness to be covered under workers' compensation. As peace officers and first responders are essential personnel, they are exempt from California's shelter stay-at-home order and are significantly at higher risk for contracting the virus in the course of their duties. Should any officer or first responder contract the virus while performing their duties, we believe this qualifies as a work-related illness that should be covered by workers' compensation. With that said, we are currently working with the governor's office and the pro tem's office to draft language and have it reviewed to either do it via an urgency legislation or through an executive order. With the testing, we want to make sure that we have a quarantine space for our officers who test positive or need to be quarantined to determine whether they have the virus or not. As officers are risking their health and safety in the course of performing their duties, we must make sure that they have a safe place to go if they do come down with the virus or need to be quarantined. The governor is currently providing homeless individuals exhibiting the symptoms of COVID-19 with the purchase of hotels. We looked into the hotel occupancy rates, and it shows that they're hovering around 10% statewide. We believe similar arrangements can and should be made for peace officers serving our communities, especially those that have families. One of a longer-term priority is vaccinations. As I mentioned, keeping our community safe requires that we also keep our officers safe. We recognize that a vaccine is being worked on, and hopefully one will be out very soon. And when it does, we want to make sure that our public safety first responders are on the priority for receiving it, or if there becomes a medical protocol that mitigates the effect of COVID-19, we want to make sure that we're on the priority list for that one too. So in closing, I want to emphasize that our officers are ready to do everything in their power to support our communities during this crisis, but they also need your support as they rise to meet this moment. We're asking our state and federal elected officials to introduce urgency legislation and support an executive order by the governor to help ensure our officers have the resources they need to show up for our communities during this crisis. While an executive order may preclude the need for urgency legislation, we're asking that our elected representatives pursue both courses until we have a viable path forward to getting our officers the resources they need. Now I would like to turn it over to our region representatives.
Damon, I don't know if you want to add anything to what I had put out.
No, not right now. I think you've covered it. I'd like to hear what our representatives have to say.
All right, Tim, did you have anything that you want to put out?
No, I think you pretty much covered it. I just got a couple real quick real world examples of, what it's like out there. Yesterday on my way home, I backed a unit on a traffic stop, and he was having to deal with, a high risk subject, a drug user, and someone that we would classify as probably being very high risk for exposure. And it kind of hit me pretty hard when he turned to me and asked me if I had a pair of gloves that he could borrow. This guy's out there on patrol, and they just don't have the equipment to do their job on a daily basis. And the other second issue I have is not directly law enforcement related, but it is because we deal with the hospitals all the time. My wife is a nurse in the hospital, and what's happening to them is they're coming on duty and they're being issued one N95 mask for their whole shift. And they have actually rules in place of when they can wear them, and have to have a known it's exposed before they can put it. So they're really trying to get through a shift. And these are the people that are directly dealing with the exposures in this clientele, and they don't even have the equipment to go in and do their job on a daily basis. And we rely on those people to keep us safe and provide the care that we need. So it is all out war out there. It's really tough on the streets, and our guys that are being relied on to deal with this stuff just do not have the resources that they need to do it safely. So that's what we're really asking for, some help here.
All right, thank you. Thank you, Tim. How about Randy? Do you have any thoughts or comments before I turn it over to Congressman Harder?
Yeah, Brian, this is Randy Perry with Aaron Reed and Associates, and we represent PORAC. I just want to be clear. We're initially seeking an urgency measure when the legislature gets back to amend the work comp presumption section to include COVID-19. However, because we don't know what the legislature schedule is going to be, we have approached the governor's office and asked if they would be willing to do an executive order to include first responders. So it would not only be law enforcement, but it would be fire and other first responders. I believe that the applicants' attorneys were working with the AFL-CIO and sent them over some language as well. So I think the administration might be looking at making it more broad for hospital workers, people who are basically essential employees who are having to work and deal with COVID-19 directly. And so that's where we're at. We have not heard what the governor has decided yet. We sent him some draft language. Well, we didn't. We sent our language to them a week and a half ago and to the Pro Tem's office. However, I know that some language last night, the broader language for an executive order was sent last night or this morning over to the governor's office in the draft form of an executive order. So that's where we're at on that.
Thank you, Randy. At this time, I would like to turn it over to Congressman Harder to do a quick update on the COVID-19 federal legislation. Congressman, are you there?
I am. Can you all hear me?
Yes.
Thank you so much for having me on, and thank you for all the work that you guys are doing. I think it's moments of crisis like this where we get a real appreciation for the work that our first responders are putting in. So thank you for being on the front lines. So far, there have been 2 COVID bipartisan bills that have passed that have been signed into law. The third was, I believe, going to be passing the Senate in the next few hours and should hopefully pass the House and be signed into law within the next 24 to 48 hours. It's a lot of money. We're talking about $2 trillion, more than twice what the stimulus package was after the 2008 financial crisis. There's a lot in there for a lot of different folks, but probably most important for our law enforcement is there's $850 million in JAG grants that are intended to go towards purchasing personal protective equipment, masks and gloves, hand sanitizer, as well as for overtime pay for folks that are having to pull some pretty long shifts. And so that money, I believe, will be available out of the federal coffers within, like I said, the next day or two. The next piece of that is to make sure that California, as one of the most impacted states in the country, gets our fair share of those resources. I think in the local calls that I've had to our sheriffs and police folks, it is pretty clear that the lack of masks and gloves is the biggest urgent need, and this will go a long way towards ameliorating that. My hope is that there will be more legislation to come to do things like making sure that we're making vaccines really available, making sure that we're helping cover things like workers' compensation from coronavirus. Those are all pieces that we have to make sure are coming in the packages that are going to come over the next few weeks. But this one will hopefully get the money towards the protective equipment in the right spot. Happy to chat more about what we're doing there, but that's the update we got. Thanks for all the work you're doing.
Thank you, Congressman. I really appreciate the update. At this time, we'll open it up to any questions. Is there any folks on here that have a question specific to PORAC or some of the priorities that we were looking at? No? How about I pose a quick question to one of my PORAC directors. Are you seeing officers being deployed to enforce the COVID-19 restrictions in lieu of the governor's executive order? Tim Davis, do you want to answer that one?
Yeah, I can discuss that. In Sacramento, we had this discussion before we issued a countywide one, and it's not law enforcement's responsibility to enforce these types of restrictions. Our job is to support our community. And so our officers are not being called upon to do any enforcement action regarding these situations. We want our citizens to comply and make the best decisions, but we trust them to do that. We do not have the resources to ensure that everyone in the region is complying, and our job is to handle the calls that are in front of us and not to be setting up checkpoints or inspecting and questioning people and where they're going.
Thank you, Tim.
Hey, Brian.
I know we have, yes.
Brian, this is Sheriff Pat Withrow down in San Joaquin County.
How you doing, Sheriff?
I'm doing well. Hey, I wanted to touch on that myself. Here in our county, all the chiefs of police and the DA and I got together, and so we'd have a joint uniformed response to this throughout our county. And like Tim said, we're just basically being there if we're getting calls from people who are nice enough to tell us who's violating the order over and over again. But we too are just doing what the governor has asked, to be an educational type force that goes out and say, hey, we're getting calls from citizens about this. This is the directive and from our local OES and the state. And we'd appreciate if you'd abide by it, and then leaving that type of enforcement up to the cities or the county or the state themselves.
Thank you, Sheriff. I'm glad that you're on this call, because I have a question that maybe you can answer, because it's been asked by several people through other conversations. Obviously, some agencies are short on PPE, some agencies not so much. Is there a opportunity for agencies that may have excess supply? And I don't mean that they have just an overabundance that could last through this entire event, but have enough to be able to share with other agencies. Are you seeing that on a statewide issue, or is that even an option?
Obviously, all law enforcement, we work together on a regular basis. So if we're hearing that some of our brothers and sisters don't have what they need, and we or other agencies have access, I'm sure that we would try and share the best that we can. It has been an issue where there's been some shortages. I hear it more on the EMS and fire side of it than I am on local law enforcement, but maybe that's something that the PORAC can be a lead on, where we have just one central area where maybe some of our smaller departments and things like that can call in and say, hey, we are suffering trying to get this stuff, and then something gets blasted out to all of us, either through the associations or just to the departments, where those who have access and those who can help. So it doesn't just impact, let's say, somebody locally here is short, then maybe around the state, if somebody has some extra stuff, that we can all share it together and get it to them. So, but it's an actual excellent point that's coming up. We're combating that locally. Our local fire is having a problem with us, because our local EMS director is mandating that every call they go on, they wear full protective equipment, and so that if somebody falls down and breaks their leg, he was not allowing their dispatch to even ask questions about people on scene, have they had any of the symptoms or anything like that, where we ourselves on every single call, our dispatch is asking those questions, so that as our officers are responding, they get the information that, yes, somebody has been in contact with someone who has been exposed, or no, there are no signs or symptoms at this time. So it adjusts the level of the protective equipment that we put on, so it saves it for when we actually need it. But I think we'd all be willing to share any extras that we have, make sure that we have our own folks have it, and everybody else does.
I appreciate that. And just to advise everybody on the call, PORAC has set up a special email address. It's covid19@porac.org. We're going to be collecting this information. I will be sending out a survey. PORAC has 920 affiliates. We'll be sending out a survey to all 920 of those, asking for more specifics on how many officers have tested positive, how many officers are in quarantine, how many officers have called in sick, and then we're going to ask about the equipment. The goal is to be able to create a rolling survey that I can share with all of our elected folks in the state and at the federal levels, so you're more up to date on what the reality is in the state of California. Obviously, we're seeing a huge trend in New York. I believe 60% of all the COVID cases are in the state of New York. We clearly don't want that to happen in California, but as the most populous state in the union, we need to be prepared that that may happen here. With that, I'm happy to take any additional questions. If not, I appreciate everybody taking the time to join us here on this call. I do want to let you know that this call was recorded, and we will be sending out a link to this event for your future reference if you didn't catch any of or all of it. And we'll also be sending out a leave behind and also our letters that we've sent to our state representatives. Does anybody else have any questions?
Yeah, Brian, can you, I couldn't get on right at exactly at 10 o'clock. Did you discuss what they are doing with those testing sites in Seattle?
Yeah, thanks, Randy. So in essence, if you haven't read any of the reports, the Seattle PD created a standalone first responder testing site. If you're a first responder and came in contact with somebody with the COVID-19 or are displaying the symptoms, they get to go to this testing site. They're tested, and then it's being they brokered a deal with the University of Washington is doing all of the tests. We'd like to see if we could get that set up throughout the state of California to where first responders can go to a dedicated site to get the testing done. I know based on the information that I've gotten from the state of California, there's 22 current labs that are testing people. And I'm just wondering if there was a way through legislation we could, or the governor's executive order, we could set those up in the, obviously prioritizing the state based on needs to be able to allow for all first responders to go there and get tested. So we're making sure that they're not carrying the virus around while they're interacting with the public. All right. Again, I appreciate all of the elected officials who took the time and their staffers to attend this Tele-Townhall. Like I said, the call was recorded. We'll make sure to send you the link, and we'll be sending you all the leave behind material. And as soon as we get this survey completed, I'll make sure that you get a copy within the next 7 to 10 days. Hope everybody stays safe and have a great day.
Thank you, Brian.
Thanks.